This dachshund, Rusty, suffers from narcolepsy, a condition that causes him to suddenly fall asleep when he's trying to do other things. Little is known about the cause of narcolepsy, except that it can be inherited. It affects humans and animals alike.
Are you or a loved one displaying similar actions? Or have a loss of muscle control, issues with sleeping, daytime sleepiness, insomnia, fatigue, nightmares, or even hallucinations? Please don't hesitate. Wake up, pick up the phone, and dial 1-800-789-7366 to reach our specialists at the Penn Sleep Center. Again, that's 1-800-789-7366. Don't wait and call now, because you or a loved one may have narcolepsy, also known as Jellinek syndrome or narcoleptic syndrome. Narcolepsy is a chronic sleep disorder that causes an overwhelming amount of daytime drowsiness and is characterized by an extreme tendency to fall asleep whenever in relaxing surroundings. Patients with narcolepsy are more likely to suffer from a higher frequency of mental illnesses, endocrine disorders, digestive disorders, and cardiovascular diseases, and had more than twice the mean annual medical costs compared with the general population. Narcolepsy affects more than 3 million people in the world. That's 3 million people that suffer from difficulties while the rest of the world rises with the vision of the bright sun and descends with the rise of the moon. Sadly, there is no certainty in the causes of this disorder. However, there are conjectures that narcolepsy is caused by a lack of the brain chemical orexin. That being said, the prognosis in narcolepsy is variable. In some patients, effects and symptoms become less problematic over time. On the other hand, narcoleptic patients may develop other sleep disorders and thus may become more problematic over time. Some patients with prominent hallucinations may develop delusions, and in some patients, periodic limb movement disorder and obstructive sleep apnea may appear after diagnosis. Humans with narcolepsy who strive to alleviate the difficulties may resort to therapies such as alternative therapies, complementary therapies, or psychotherapy. If you or a loved one are suffering, you can help them or yourself by having regular checkups, a strict bedtime schedule, monitoring actions, and sustaining good health. Narcolepsy can be a serious issue, but it may be confused with sleep apnea, circadian rhythm to sleep disorders, restless legs syndrome, epilepsy, and depression. It is often thought that narcolepsy is easy to diagnose. There is a cure for narcolepsy, and that sleeping more will help cure narcolepsy. Unfortunately, it is difficult to diagnose, and there is no cure. There may be no cure, but there is still hope. Hope for a world where people can sleep with no difficulties. A world that is narcolepsy-free.